Hi, I'm Dr. Kassicieh with Sarasota Neurology and Florida Headache Center. As one of the leading headache specialists in the state of Florida, I'm here today to talk to you about migraine headache. Migraine is a common disease process affecting approximately 40 million Americans and 1 billion people worldwide. The World Health Organization considers migraine as one of the top 10 leading causes of disability in the world. Migraine headaches are a disease process much like diabetes or asthma. Migraines require medication therapy. There are two types of therapy. One is acute migraine therapy that you take only when you have a migraine headache, and the other big category of medication are migraine preventative therapy. The mainstay focus in migraine treatment is migraine prevention. We would prefer that you not have a migraine headache. Let's focus first on migraine prevention, since that is the first line of treatment for most migraine sufferers. For many years, we have had different migraine preventive therapies. They have varying degrees of success and efficacy, but the unfortunate fact is that many of them have side effects. Many migraine sufferers needed to be on 2 or 3 of these medications, and even then they had limited benefit. The migraine preventative drugs that we had available to us for many years were all 20th century drugs. We have now moved into the 21st century and have a whole new class of migraine prevention medications known as the CGRP blockers. These CGRP blockers have a very high degree of migraine blocking efficacy, much better than any of the other medications that we have ever used in the past. They are all monoclonal antibodies and are administered as a once-a-month subcutaneous injection. The CGRP blockers work by blocking the first initiating cascade on the way to a migraine headache. The FDA has approved 3 new CGRP blockers. The first is Aimovig, which was approved in May of 2018, followed by Ajovy and Emgality, both approved in September of 2018. The use of CGRP blockers allows you, the migraine sufferer, to possibly wean off the other migraine prevention drugs that may be causing you side effects. Our experience here at Florida Headache Center is that our migraine sufferers, whether they have episodic or chronic migraine headache, have seen a dramatic drop-off in the number of monthly migraine headache days that they have. Episodic migraine sufferers are defined as having 14 or fewer migraine days per month, whereas chronic migraine sufferers are defined as having 15 or greater headache days per month. We have seen patients suffering from 30 headache days per month get started on the CGRP blockers and see their headaches plummet down to having 2 to 4 migraine days per month. Some patients even obtain 0 headache days per month with the use of CGRP blockers. In patients that have had this dramatic drop-off in the number of their headache days, they can be weaned off of their other migraine preventative drugs and feel much better off of these medications. The other nice thing about the CGRP blockers is that it gets rid of the other migraine symptoms that migraine sufferers have, such as brain fog, migraine fog, feeling poorly, worried about going out somewhere because they're going to have a migraine, and it also allows them to spend more family time, go on vacations, and do other activities that they may not be able to do because they are afraid of having a migraine headache. With the use of the CGRP blockers, we can see such a dramatic increase in the quality of life of our migraine patients that they never had before in their life. Imagine if you had migraine headaches for 40 years and you had 15 headache days per month. That means that half of those 40 years, or 20 years, you were spending in bed, disabled, throwing up, and incapacitated because of your migraine headache. With the use of the CGRP blockers, we can cut that down to a minimum number and allow you to have your life back and improve your quality of life. We have seen patients that suffer from intractable headaches that do not respond to other preventive medications get started on the CGRP blockers. This even includes our chronic headache patients that get started on CGRP blockers that have such a dramatic drop-off in their migraine days that they have virtually 0 headache days per month. These patients consider the CGRP blockers truly a miracle drug for their problem. Here at Florida Headache Center, we have many patients on the CGRP blockers for their migraine headache problem. Many of these patients had chronic migraines having up to 30 headache days per month. Once they were started on the CGRP blockers, some of these patients dropped down to 0 headache days per month, giving them their life and quality of life back. These patients consider the CGRP blockers a miracle drug. Since the CGRP blockers were first approved in May of 2018, and I started all of my Botox migraine patients on a CGRP blocker, I have not had to give any of those patients Botox again because of the high efficacy of the CGRP blockers in blocking patients' migraines down to very few or none per month. So, if you're tired of the Botox headache roller coaster effect, the CGRP blockers would be an ideal migraine preventative therapy for you. If you suffer from 4 or more migraine days per month, the CGRP blockers may be the life-changing therapy for you. Please contact the Florida Headache Center at Sarasota Neurology at 941-955-5858 to allow us to help you improve your quality of life.